The first time I encountered Listeria, it did not look dramatic. There was no chaos in the emergency room, no alarms, no visible panic. It was just a quiet 63-year-old woman with a fever that would not go away. She told me she felt flu-like, muscle aches, mild headache, nausea, nothing extreme. Her vital signs were stable, blood pressure normal, oxygen fine. But something about her expression unsettled me. Experience teaches you to listen to subtlety. 2 days later, her condition changed. She developed neck stiffness, confusion, a tremor in her hands. The diagnosis would come soon after: Listeria monocytogenes. When most people hear the word bacteria, they think of food poisoning, a few unpleasant days and then recovery. But Listeria is different. It is patient, it is invasive, and under the right conditions, it can become very serious. Listeria monocytogenes is a gram-positive bacterium found widely in the environment. It lives in soil, water, decaying vegetation, and even in the intestines of animals. Unlike many bacteria, Listeria has a remarkable ability. It survives cold temperatures. Refrigeration slows most pathogens. Listeria does not stop multiplying easily at low temperatures. It continues to grow quietly inside ready-to-eat foods. Deli meats, soft cheeses, unpasteurized dairy, smoked fish, prepackaged salads. Most healthy adults exposed to Listeria will never know it. They may experience mild symptoms, fever, diarrhea, muscle aches, and recover without complications. But Listeria is not dangerous because it infects everyone. It is dangerous because of whom it affects most severely: pregnant women, newborns, elderly individuals, people with weakened immune systems. In these populations, Listeria does not stay in the gut. After ingestion, the bacterium can invade the intestinal lining. From there, it may enter the bloodstream. Once in circulation, it travels. And Listeria has another unusual trait: it can cross the blood-brain barrier. Few bacteria have that capacity. When it reaches the central nervous system, it can cause meningitis or encephalitis, inflammation of the brain and surrounding tissues. This is when the infection becomes life-threatening. In pregnant women, Listeria can cross the placental barrier. The mother may feel only mild flu-like symptoms, but the bacteria can infect the fetus, leading to miscarriage, stillbirth, or severe neonatal infection. I have sat in rooms where parents asked, "How did this happen?" Often the answer was simple: a sandwich, a piece of soft cheese, smoked salmon at a gathering. Listeria does not announce itself. It hides inside ordinary food. What makes Listeria particularly sophisticated from a microbiological standpoint is its intracellular lifestyle. Unlike many bacteria that remain outside human cells, Listeria enters cells and uses their machinery. It produces Listeria lysin O to escape internal vesicles once engulfed by immune cells. Then it moves through the cytoplasm using actin filaments to propel itself forward, spreading from cell to cell without exposing itself to antibodies in the bloodstream. It is a microscopic tactician. When we confirmed the diagnosis in my patient, the lumbar puncture showed clear signs of bacterial meningitis. We began intravenous antibiotics immediately, high-dose ampicillin. Early recognition saved her life. But not every case is recognized quickly. Listeria enters through something ordinary: a meal. There, through molecular interactions, it binds to epithelial cells and gains entry. It does not simply float in the gut, it invades. Once inside cells, it escapes destruction and uses the host's own actin fibers to propel itself. It spreads from cell to cell without exposing itself to circulating antibodies. This ability to remain intracellular gives it a strategic advantage. In healthy individuals, cellular immunity, especially T lymphocytes and macrophages, often controls the infection. The bacteria may be cleared before they ever reach the bloodstream. But in those with weakened cellular immunity, the barrier fails. Pregnancy creates a unique immunological state. The immune system shifts to tolerate the fetus. This shift, while necessary, reduces certain defenses against intracellular pathogens. Listeria exploits that window. Older adults experience immune senescence, a gradual decline in immune efficiency. Chronic illnesses such as diabetes, cancer, kidney disease, or the use of immunosuppressive medications further weaken defense mechanisms. When listeria enters the bloodstream, it can travel widely. The liver and spleen are often the first organs involved. These organs filter blood and attempt to contain pathogens. But listeria can persist even within immune cells, using them almost as vehicles for dissemination. The most concerning progression occurs when the bacteria cross protective barriers. The blood-brain barrier is designed to protect neural tissue from toxins and pathogens, yet listeria can penetrate it. Once in the central nervous system, inflammation follows. Meningitis presents with fever, headache, neck stiffness, and altered mental status. But in listeria cases, these symptoms may not appear all at once. Sometimes only confusion is present, sometimes only persistent headache. Brainstem involvement, rhombencephalitis, is particularly characteristic of listeria. Patients may develop double vision, facial weakness, difficulty swallowing, imbalance. These symptoms can mimic stroke, complicating early diagnosis. Diagnosis relies on blood cultures and cerebral spirit fluid analysis, but laboratory confirmation takes time. Because listeria is resistant to cephalosporins, empiric treatment in high-risk patients must include ampicillin. This detail is not academic. It is life-saving. Separate raw and ready-to-eat foods. Maintain refrigerator temperatures below 4 degrees Celsius. These measures are not extreme. They are practical. For most healthy adults, the risk of invasive listeriosis remains low. The immune system manages exposure effectively. But when vulnerability exists, awareness becomes essential. Recovery from invasive listeriosis can be prolonged. Neurological inflammation may leave temporary or permanent changes. Older adults may require rehabilitation to regain balance and strength. Neonates may need developmental monitoring. Yet many patients recover fully with timely treatment. Listeria does not typically become chronic. Once appropriately treated, recurrence is rare unless re-exposure occurs. What remains is understanding. In medicine, prevention often goes unnoticed. When it works, nothing happens. No hospitalization, no intensive care unit, no prolonged antibiotic therapy. That absence is success. Listeria teaches a broader lesson about health. Risk is not constant across life. Youth brings resilience. Pregnancy brings immunological change. Aging brings reduced reserve. Chronic disease alters defense. Awareness must adjust accordingly. Food should remain a source of comfort, connection, and nourishment. But understanding food safety, especially during vulnerable periods, protects that comfort. The purpose of knowledge is not fear, it is timing. When symptoms appear in high-risk individuals, early evaluation matters. When prevention guidelines exist, they are based on experience. Listeria is uncommon, but when invasive, it is serious. It begins quietly, it spreads silently, and it is treatable when recognized. Medicine does not promise elimination of all danger. It offers understanding. And in the case of listeria, understanding changes outcomes.